In this scenario, when asked about the purpose of the HPV vaccine, the pediatrician effectively presents it as a cancer prevention vaccine.
Your immunizations are all up to date, except I see that you hadn't started the HPV series yet, and I wanted to get that series started with you today. Do you know anything about that?
Well, our doctor in Pennsylvania said that those were optional, and as my understanding, the schools didn't require it, so we haven't done those.
Well, actually, it isn't required by California schools right now, but it is highly recommended. And I recommend this shot for all of my patients, both teenage boys and girls.
So why would the HPV shot be important?
Over 33,000 cases every year of cancer are due to HPV, and we could prevent the majority of those cases if everybody just got this vaccination.
You said it's a series of shots?
Yes, it's a series of 3 shots. We can give the first one today. The second one will be 2 months at least from the first one. It can be a little longer if needed, but 2 months after the first one, and then the third shot is 4 months after the second one. And so if we get that started today, we could get her caught up in the next year and she'll be all up to date.
Notice that the pediatrician clearly outlined the dosing schedule for the family and ensured that they received the first vaccine at this visit. When presenting the routine immunization schedule for the age 11 to 12 visit, it can be helpful to mention HPV as the first or second rather than the third vaccine on the list, to further reinforce that it is not optional or an afterthought, but rather prioritized equally with Tdap and the meningococcal vaccine. Back up your own strong recommendations with the endorsements from multiple professional societies, such as the American Academy of Pediatrics and the American Cancer Society. It is also helpful to share your personal experiences with the HPV vaccine. If you chose to vaccinate your own children, if you recommend the vaccine to friends and family, or even if you chose to vaccinate yourself, then sharing that with your patients will give them added confidence that you believe in the HPV vaccine and are recommending it in their best interests. Many parents who associate HPV with genital warts rather than cancer may be understandably concerned or confused about why their 11-year-old child would need vaccination. The most effective way to address this is to emphasize that this is a cancer prevention vaccine, and that all children are at risk of an HPV-related cancer in their lifetimes, even if they do not engage in sexual risk-taking. It can be helpful to quantify how common HPV-related cancers really are. Many parents are eager to vaccinate their children against meningococcal disease, but every year in the United States, there are less than 1,000 cases of meningococcal disease, compared to over 25,000 cases of HPV-related cancers. For male patients, it is critical to discuss the types of HPV-related cancers in men against which the vaccine can provide protection.